Following on this discussion of patients' feelings after a surgery, now we're going to look at how they adjust to life following a cardiac event.
So as my fellow colleague, Dr. Fitzpatrick said, the importance of supportive relatives on recovery. However, it's also important to mention that cardiac crises are distressing events, and they also may challenge the patient's abilities to manage their emotions effectively. How they interpret their emotions about the cardiac events predicts psychological functioning such as depression, anxiety, and trauma, and relational functioning. In 2011, So and LaGuardia found that the more patients attempted to inhibit their emotions and the less they disclosed their feelings to the partner about the cardiac event, the greater the symptoms of depression, anxiety, and post-traumatic events would be, and the less close and satisfied they would feel with the partner. So therefore, the more they try to ignore their feelings and the more they don't disclose to their partner, the more worse their psychological and relational function would be. These findings support prior work, such as Joseph and Linney in 2008, suggesting the possibility of experiencing positive relational connections in the face of significant traumatic events.
As Dr. Beiruti mentioned about the lifestyle adjustments, the challenge lies in finding a balance between the restrictions that the illness brings about the challenges of everyday life. Quality of life is the subjective experience of an individual regarding multidimensional domains such as emotional health, social networks, physical health, work, and productive activities. Leventhal and Contrada proposed the self-regulatory model, which deals with the personal representation about the nature of illness that people develop. There are 5 central components. First, the experienced symptoms which are attributed to the illness, identity. Second, beliefs about causes of illness. Third, beliefs about the curability or controllability of the illness, cure control. Fourth, perceived consequences of the illness in the person's everyday life. And fifth, expectations about duration of the illness. These domains are involved in making quality of life adjustments better for the individual. Quality of life is poorer for those who associate more symptoms with CHD and regard CHD as uncontrollable.
So that leads us to the end of our panel discussion. That was very, very illuminating. Thank you to our international doctors for coming down to our little island to let us know much more about CHD. So now we'll be talking to a man who's been coping with CHD for the past 5 years, a Mr. Salvu Bezzina Cremona. Hi, Salvu. Thank you for joining us.
Ta' xejn hija, aħna dejjem naraw, speċjalment il-mara tgħidx kemm tħobbok.
I'm glad you and your wife enjoyed the show. So, Salvu, can you tell us some of your story?
Dak darba minnhom kont fil-ġnien u qabadni u ġieġ u sidri u fidi xellogija u daqshekk bum waqgħet mal-art. Imbagħad konji l-mara ġiet, ċempet l-isptar u batuli l-ambulanza. Imbagħad qomt l-isptar hux, ma tantx kont inħossni tajjeb, imma tal-inqas kont ħajjux.
Wow, that must have been a shock to the system. So what did the doctor tell you?
Għalli attak tal-qalb hux, għalli xi ħaġa coronary, xi ħaġa disease. Dan hawn problema tal-qalb hux. Insomma, jien ma tantx kont sorpriż ta' kif kont innejx, kont impejjew kważi pakkett kuljum, passizzi bla doċċ, quddiem it-television kuljum, stress, insomma, u inti taf kif le? Ma tantx kont innejx healthy hux.
I see. So what did the doctor advise you to do?
Għalli naqta s-sigaretti u x-xorb, naqta l-melħ, nipprova nagħmel daqsxejn eżerċizzju iżjed u tani l-mediċina. Dawn l-affarijiet ma kienux faċli ta' biex nagħmel, għadni ma tarċ is-sigaretti għal kollox hux, imma ngħix ħafna aħjar bħalissa milli kont qabel problema ta' qalb.
That's good to hear. Can you tell us some more about how you're living nowadays?
Fil-ħodu mor nimxi, nagħmel nofsija, kuljum ta' anka l-ħadd. Dieta biddelta kompletament, nikol iżjed ħaxix u frott. Taf intux, dak ma sax tagħmel melħ fuqhom, qed nixrob ħafna iżjed ilma minflok kafe u te, kelli naqta l-futbol dik l-ikbar problema ta' ġan li kelli naqta l-futbol li nagħmel issa hu nirrekordja l-logħba. Imbagħad nara r-riżultat, imbagħad nara l-logħba. Hekk innaqqas l-istress hux. Ma tafx int? Ħanamlu hekk. Kien daqsxejn diffiċli tal-ħaġa imma mnalla l-mara ta'.
Your wife. How have your family and friends reacted because of this condition?
Il-mara il-mara Anġlu, u xitan ta' ukoll. Imma ħanajdlek, kull darba li anka naħsibat nikol passis tajjat meta li salv! Għara bis taħsiba ta' vera stretta. Imma ħanajdlek, għattam li d-dieta miej u tiġi timxi miej kol jum ta' apparti l-ħat ħabba l-qoddis. Imma tajjeb u kol ta' għaxum bat il-ħat tiġi rita timxi miej. U nejdu ekkux, li kalli ħbib ġodda u koll tnaqqas l-istress ta' jek tifimni. Imma, apparti ċajt, il-marja tiegħi ħafna t-support jani da palissa biex nejx aħjar.
That's good news. So, how are you feeling after all these lifestyle changes?
Biex nkun onest, ħafna ħjar ta'. Ma naqtax nifsi til-attaraġ. Jo meta mmur nimxi. Tlif ta' xejn mhux ħażin mill-qad u naħseb anke xart jerġa' jikber li. U eħfef palissa nibqa' kalm meta niġu ċerta sitwazzjonijiet hux. Għal-bidu għed ħatkun ħafna tqalta, imma mbagħad mhux daqshekk ta' mal-mara u l-ħbieb jgħinuni, possibbli kienux.
Wow, it sure seems like you've had to make some adjustments to your life. Well, that's all we have time for today, Salv. Thanks for your time.
Ta' xejn hija, u prosetar boħra tal-programm.
So, that brings us to the end of our show today. As we have seen, CHD can be chronic, but there are ways to cope with it. Exercise, eat healthy, have friends, don't smoke. Join us again next week for our show on terrorism, where Dr. Beiruti will be joining us. I'm Jonathan Chilio, and remember, stay classy, Bisai. Welcome to the show. Today we are going to be talking about coronary.
And from the hypothalamic pituitary gland.
Now we're going to turn to Dr. Fitzgerald. My name is Fitzpatrick. Thank you, Dr. Burrito. Okay, thank you, Dr. Thank you, Dr. Berry. Oh my God. A roti. Bay. It's a bay, not a bar. It's a bay. So that brings us to the end of our show. As you have seen, CHD can be chronic, but it can be avoided. Eat safe, not eat safe. So that brings us to the end of our show. As you have seen, CHD can be chronic, but there are ways to cope with it. Exercise, eat healthy, have friends, and don't smoke. Stay classy.
For our show on terrorism.
I'm not gonna. I never heard this with you. I'm Jonathan Chilio, and remember, stay classy, Bisai.